Welcome back to OpenLine. We are talking about home health care. This is an industry that has really exploded in Middle Tennessee and across the country. And the push to keep people out of nursing homes, keep parents or elderly loved ones in their own homes. We have with us Neil Amrine, all about care, home health care service. Let's go back to the phones. Robert. Hello, Robert.
Hello.
Go right ahead. What's on your mind?
I want to know how I could get in the business because it's a booming business. I could maybe make some money and make a living. What I do to get a job in the business?
All right, so
healthcare.
All right, I'll take that a couple of ways. So let's say someone wanted to open a company, which maybe there's so many already. But let's start with they want to be an employee. Like what are you looking for in an employee? And again, if somebody were going to hire a company, what should they want to see in the employees of that company?
Good question. So it is fast paced and growing. And as you mentioned in the last segment, the struggle we have is finding good quality individuals who have the right, what we call the right DNA to join our organization. 2015, we went through about 2,700 resumes and only selected just over 100 folks. So what we're looking for are folks that are interested in not only caring for others, but have, again, the right mentality for service, because we're really in the service business. Because we're non-medical, it doesn't necessarily require an extensive medical background or history. And as I share with my team quite frequently, in our lifetime, we're all going to fall into one of these four categories, or we already have, which is we have either cared for somebody, we are caring for somebody, we will care for somebody, or somebody will care for us. And so, when you think about it in that category, in that sense, we'll look for folks with a pretty extensive background, maybe in volunteer. We have a number of folks that have spent years volunteering, individuals who are on the medical or clinical track. Maybe they're going to be future therapists or future nurses, future doctors. And, I've had the pleasure of writing some reference letters to medical school, which has kind of been fun, and allowing folks to take that step. So it's a good entry point for the folks with the right, like I said, the right DNA.
2,700 resumes. Is that what you said? And you picked 100. So is it hard to find employee, because this is an around-the-clock type of business? Is that pretty much the hardest thing you do?
That is. I spend most of my time, and a big section of my leadership team spends most of their time combing through resumes, trying to get folks through. We have a hiring process that's pretty stringent, and so we're looking for certain things because we've hit some pitfalls over the years, right? So it's a lesson learned with so many hundreds of thousands of hours of services that we provided, and like you said, around the clock. We don't close. I mean, we're open for holidays. We're open, on the weekends, the third shift. We've got folks that need us at 5 o'clock in the morning, and some folks that need us, between 8 and 11 o'clock at night. So we've got to be able to find the folks that can do that and have a backup plan, as I mentioned earlier, right? Not just one person to rely upon, but some team that can deliver that care plan.
What's the average age of an employee? Yeah, and I'll do both. The average age of the person that you're watching, so the client, how old is that person? And how old generally are your employees? Is there an average age?
I don't know if there's an average age. Last year, our average age client was 82. We do have a couple centennials, and we also have been providing some services for folks, teenagers, and folks with special needs. So that's been kind of a growing situation as well. They need more than just kind of a nanny or a babysitter. They need somebody who can come in and has the right demeanor, has the right temperament, has the right level of experience, and to be successful with that that individual who needs. Has special needs. As far as the average age of our caregivers, our profile is probably 35 or 40% between the ages of 22 and 35. We also have a number of folks that are retired.
Right.
That helps
so
out quite a bit.
Sides
yeah.
Oh, that's good. Okay, let's go to Hobbs. Hello, Hobbs. Hobbs, are you there? I bet Hobbs is there, but we're going to put him on hold and get Hobbs back. The other question Robert had was about starting one of these himself, and that gets back to the whole issue of regulation and just the explosion. Do you think we are still on the uptick as far as the number of these businesses, or do you think we're seeing a peak and maybe it's beginning to level off? What do you think? You said 400 in Middle Tennessee.
Mm-hmm.
So are we still going to continue to see more, or is it going to level off? What do you think?
I think we'll see more. I think that we need to see more because I think competition really makes a better quality of delivery of service. So it's very fragmented right now, and frankly, Ben, there can be massive consolidation that will be taking place, I would say, over the next 5 to 10 years. And just because we have, as everyone knows, 10,000 people turning 65 every single day for the next 10 years, we also have about 4,000 folks who are turning 80 every day as we speak. So it's not necessarily the folks who are turning 65 that are looking or needing or even thinking about companionship services or help with activities of daily living. It's a 20 or 30 year challenge.
Those stats, see, that's amazing. All right, I think Hobbs is back. Are you back, Hobbs? Hobbs, are you back?
Yes. My question is, how does one differentiate, or how does Mr. Amron differentiate providing non-medical versus medical care?
All right, very good.
Good question. So we're not licensed or insured to jab anybody with a needle or pop pills in people's mouths. So nothing is invasive that we're permitted to do. We can help with transferring, we can do medication reminders, but even pill boxes or medication planners have to be allocated by either a loved one or a physician, a pharmacist, a nurse. We are there purely to help with anything related to hygiene, transfer, toileting, bathing, dressing. We are not permitted or licensed to change bandages or do anything of that sort of either. So if there's an open wound, about 15% of our clients are under hospice care. So an open wound would require a nurse or someone to come in and help. Good question.
Let's go to Lucy. Hello, Lucy.
Hello, y'all. I've got a couple little questions first before I want to tell a little story.
All right.
Okay, my first question is, you said that I'm looking at you basically as a setter service. I know you probably have some CNAs and everything, but you said that some of your employees are retired. These retired employees, do they bathe and transfer your clients?
Sure.
Okay. What was my second question? Oh, I forgot it. But anyway, it might come to mind. Here's my story.
All right.
I had a friend that he was a veteran, and he was kind of an elderly man in his 70s, and VA provided him in-home care 3 days a week, where a housekeeper would come by 3 days a week. And you would think to VA that there would be some oversight there. Well, when they, put him in the nursing home and threw away the key, it was because he had dust bunnies under his bed was the main argument, and that there was garbage in his kitchen, so therefore he was unable to care for himself. But what was happening is when the VA person that VA had sent out never came. But somehow or another, somebody was signing off that they came. They never came in the house. So there was no oversight there. And about a year after he died, the state of Tennessee came up with this plan saying, it would be cheaper to have in-home health care instead of putting people in the nursing home. And by the way, he was on Medicaid, and it was costing us $6,000 a month to keep him in that Alzheimer's ward, where he really didn't have Alzheimer's, but that was a safe place to put him, to keep him locked up so he wouldn't run away. But anyway...
Now, is this a friend of yours, or is this a loved one?
This is a friend of mine.
Okay.
And he had they had come out to the state of Tennessee when they passed upgrading after his death, this in-home health care or a sitter kind of thing or a house cleaning kind of thing. They decided in the state of Tennessee to put no oversight in that. Now, under the Affordable Care Act, and for, what Republicans call Obamacare, they were supposed to upgrade the Medicare part of this for in-home health care like you're talking about and what he was supposed to get. Do you do any of that, and is there oversight on that?
All right. Thank you, Lucy. What
Yeah.
about that?
Let me address, Lucy, the initial part of your question, which was regarding sitter and sleeper business. This industry, unfortunately, has gotten a really bad reputation for, in some cases, for good reason, for being comprised of individuals who are sitters and sleepers, and that's something that we talk about within our organization. That we are not in the sitter and sleeper business. That we are professional caregivers, home health aides, individuals that are engaged not just physically but emotionally, cognitively, mentally, and that's a big part of providing that quality of care and that delivery of service. So it's a shame that that oversight did not exist. There are certain things, as I mentioned earlier, about transparency and accountability that I think with technology it's going to get better. The quality of care is going to get better. I think it can help drive down the costs. That something that someone who may be $15 to $20 an hour to bring into the home. I think long term there'll be some technology and oversight that is out there, and some of it's out there today to provide that, as we like to say, delivering dignity with the right technology, and that's something that it's unfortunate it's not rolled out on the same level across the board. But
I think she mentioned the Affordable Care Act. What we're talking about here is health care. In a sense, it's health care.
Right.
It's somebody who needs someone to watch them, to help them. Affordable Care Act, big changes to health care. How does that impact this industry? If at all?
On a couple of levels. I mean, if it's employer related, as far as providing benefits. So for the most part, you've got that threshold of 50 or so individuals that you have and you've got that 29-hour work week and some things that are taking place where you're trying to figure out how does that work out. If you're a home care agency with 300 or 400 or 500 or 1,000 home care workers, what are you doing to offset those costs? And are folks coming on board to become professional home care providers as their career? It has become and evolved more over the last 15 to 20 years as a career path for a number of folks. As far as the Affordable Care Act is concerned, it hasn't affected my business or what we do because we're more or less in the concierge personal assistant business. And so since it's private pay, families have the right to fire us or hire us at will, and we do everything we can to provide that level of service and that quality of care every day. So on the employer side, it's a little bit tricky because it does affect benefits and
there's been some big
HR
changes.
Yeah.
And big change. Department of Labor came up with new rules. We can even talk about that. But we're going to take a break. And also I want to talk about some stories of people that have come through your doors. And if you want to call and you have a story or a question, there's the number, 615-737-PLUS, 615-737-7587. We'll take a break. Be back right after this.